Today, we have received 2 additional positive COVID-19 test results, bringing our Chautauqua County's total to 5 positive cases. One of the new positive cases was a gentleman in his 60s with recent travel to the New York City area. The second is a female in her 30s with no recent travel history. We're continuing to take steps in Chautauqua County to lead the community preparing as the COVID-19 situation evolves locally. My COVID-19 response team and I have continued to advise and communicate with healthcare leaders, first responders, our emergency service teams, and all those involved in the response. Our emergency service team continues to track down and coordinate supplies, and our economic development IDA team continues to assist local businesses with implementing the state's orders and assistance programs that are available. We also have to announce that this time the Chautauqua County has extended the time period delinquent property owners have to pay property taxes to avoid the county's current foreclosure process. The deadline has been moved from April 15th to June 18th of 2020. Again, the deadline to pay delinquent property taxes has been moved from April 15th to June 18th. I'd just like to add that it is our community responsibility to rise to the challenge and help our fellow neighbors. Helping them begins greatly by social distancing, and as has been asked by the State Department of Health, stay safe and stay home. Pitch in and help as you can. One of the things we can do is reach out to our neighbors, asking them if they need assistance. Also, if you're feeling well, reach out to an elderly family member or neighbor and ask if there's something you can do for them. It may be getting them groceries, a trip to the pharmacy, or just checking on their well-being daily. One of the things we need to do is social distancing, as we have said before. The reason we're doing that, amongst trying to prevent the spread of COVID-19, is a unique group of individuals we've termed and called the greatest generation. This greatest generation has lived through world wars and several things in their lifetimes, but now this invisible war makes them the most vulnerable members of society. We urge you to remember our social distancing and to help out those who are helping us out through our lives. There is a billboard that I travel through past each day, and it says, "Please help your hero because they helped you throughout your life." And it's a gentleman helping out his mother, and I think that's really poignant as we move through this and something to keep in mind, that those heroes we remember, our parents, our grandparents, are the ones who need our help now, and social distancing is the best way we can help them. At this time, I'm going to turn the microphone over to Christine Schuyler, our Public Health Director, and she will open up with her response.
Good afternoon, and thank you. As County Executive Wendell said, we now have 5 confirmed cases of COVID-19 in Chautauqua County residents. In addition, there are several individuals who have received isolation or quarantine orders from me as the Public Health Director. We currently have 16 individuals in mandatory quarantine. That means they are individuals who have confirmed positive for COVID-19 or they are a household contact of a confirmed positive case. We have 38 individuals in precautionary quarantine. That means they have a travel history to the CDC level 3 countries or a proximal contact of a confirmed case. We have 49 individuals in mandatory isolation. That means they are symptomatic of COVID-19 and are pending COVID-19 lab results. To date, we have received 66 negative test results for COVID-19. My public health nursing staff are actively conducting their epidemiologic investigations to determine the close contacts of these 2 latest individuals who have tested positive. Anyone who is deemed a close contact or proximal contact by investigation will be notified personally by one of my nurses. If there is a need to publicize any locations, we will do so. If there are no locations publicized, then you can rest assured that our investigation did not deem it necessary. You may have noticed that in today's discussion of these 2 positive cases, we're not giving a demographic location. And I'm going to be very frank and honest when I tell you it doesn't matter. we have proof positive that COVID-19 is now spreading throughout our community. There are cases located in all ends of the county, in every neighboring county around us. Today, Cattaraugus County, next door, announced their first case. What that means is we really need to be vigilant. We need to be aware that we have a very serious virus spreading in our nation. This virus is more easily transmittable and more lethal than influenza. That's why everyone is really trying to get this message across, and the measures that have been taken are strong ones. Please abide by the social gathering advice that we've given. This is not the time to get together with your family and your friends. This isn't the time to go to a church service, a large funeral, a wake, a wedding. I know all of these life events are very important, but they can wait. I think another thing that County Executive Wendell and I would like to get out there for everyone, while there are no bans of anyone traveling anywhere within this country, within the state, within this county, we would highly recommend that if someone is traveling into this area, or you know of someone, a family member or a friend, who maybe is traveling back to this area, please advise them to stay home, to self-isolate for 14 days, just to ensure that they are healthy. And especially if they're elderly and they are what we call a snowbird and traveling back home, it's also in their best interest to self-isolate, get themselves fighting strong so they are as healthy as they can be. Now's not the time to go shopping and stock up on all your groceries because your cupboards are empty. Reach out now and help your neighbors and your friends who maybe are coming back from down south or some other area. We are all in this together. The future of this pandemic and how this virus spreads is in your hands. Either we can control it and contain it and keep the number of cases down and the number of illness and death down and not overrun our already taxed healthcare system, or not. It's up to you. I hope that you will join in our fight and keep Chautauqua strong. Thank you.
Thank you. At this time, we'll go through our media list and ask for questions. We'll start off with the Dunkirk Observer. Mr. DiAgostino, do you have any questions?
Yeah, the question we have is how many ventilators are currently in the county, and are any being sent to New York City?
I'm sorry, but I did not hear that question because it echoed. I'm sorry. One more time.
So I'll try again.
Okay, oh, it's better already.
Okay, how many ventilators are there in Chautauqua County, and are any being sent to New York City or downstate?
I don't have the number of ventilators off the top of my head, but I can tell you that no resources in Chautauqua County have been sent outside of Chautauqua County.
Thank you.
Any other questions? Okay, moving on. Spectrum News, Mr. Mark Goshgarian.
Hi, thank you for taking my call. This is for Dr. Schuyler. Earlier today, we spoke to Beth Stark. We talked about the need for child care for essential families and the effort to recruit these families. And she said that she was working with you guys, and you were able to get a waiver to accept more families and things like that. So can you tell me a little bit about the effort you've made in the child care arena and why this is so essential for essential workers?
Well, I can tell you that on the social services side of Health and Human Services Department, we oversee the administration of the subsidized child care program. My Deputy Commissioner, John Anderson, and his team have been working closely with Beth Starks and others in trying to put together some contingency plans for how we can best help out those who are in need of child care during this time. Every school district was asked by the State Education Department to submit a plan of how they could help to either as a site or provide resources to assist the health or the child care needs of healthcare personnel and first responders. Those plans were submitted to the state, and Beth Starks and her group, along with my staff, have been working with schools, with Chautauqua Opportunities and other agencies to try to put together as best as we can more opportunities, more places, and funding as well for those who are in need of childcare, who are essential to our workforce right now, with a priority on healthcare providers and first responders.
Why would you encourage them to take advantage of that? I mean, obviously they're in a unique situation where they still need to go to work, and this may be the first time that they've ever really needed the need for child care. Either their children were in school or perhaps, grandma and grandpa watched them. So I guess how unique is this situation and why?
No, exactly. Traditionally, there are the requirements for subsidized child care are much more stringent, and the state has relaxed a lot of that. And we were very fortunate here in Chautauqua County that we had quite a large, what's called a rollover. So we had some money left over from our federal child care development block grant. So we were able to roll those funds over to now use to help to subsidize more of the child care needs of a wider range of population of people.
Thank you for your time. I appreciate it.
Thank you.
Now WDOE, Dave Rowley.
Good afternoon, everyone. Want to get your thoughts. Are you getting enough supplies now as far as the hospitals, as far as testing in the county, or is that still a problem?
Well, I can tell you that, yes, testing is a problem. It's been a problem, and it's going to continue to be a problem for the foreseeable future. I hope it won't be a long time, but there has been a nationwide, statewide, countywide shortage of testing supplies, including swabs and viral media that are needed to actually run the tests for COVID-19. As of today, there is very, very limited testing in the county. Testing is being prioritized for those whose illness is severe enough that they are hospitalized, or healthcare workers who are symptomatic of COVID-19, and also those in nursing homes who could be showing signs of COVID-19. I wish that weren't the case. I wish this country would have been better prepared and on board and had COVID-19 testing supplies and the actual test and the ability readily available, but we weren't. So now this is an area where we are absolutely playing catch up in. There is a new test that's been approved that has a 45-minute turnaround time for results, which is a huge improvement. We have been seeing anywhere from, had been 4 to 6 days. We're now down to within 48 hours with Quest Diagnostics. But the new test, UPMC Chautauqua, is our first one that I know of that could be online to do this test, and that could be a game changer because the supplies that are needed to collect those specimens and do that testing are different than what it currently requires now with a certain kind of swab and viral media. So I'm very, very hopeful that in as soon as another week, we could be in a much different place when it comes to actual testing for COVID-19. But I'm going to qualify that by going back and saying, we know it's here. The best thing that everybody could do is act like they have it and act like the person next to them has it. Maintain that 6 feet of social distancing as best as you can. I realize there are caregivers, you have little children, there are people that you're taking care of. Your typical normal household contacts are the people you're always with and you're always around. But when we're really talking about the people that you're not with all the time, really that 6 foot really comes into play. Keeping frequently touched surfaces cleaned. COVID-19 is pretty easy to kill actually on most of surfaces with Windex, for instance. Bleach is overkill, but bleach is needed if we want to get rid of the influenza germs that are also on these commonly touched surfaces. And we are still in the middle of flu season. Flu is still widespread in Chautauqua County. So I encourage you to please continue doing what we're doing to try to dampen down the number of cases that we have, because people do have it. They just have not been tested and probably aren't going to be tested, but that doesn't mean that they're not carrying COVID-19 and couldn't spread that. That doesn't mean I want you all to panic and think you're all going to die. That's not what I think. 80% of people will be very mildly ill. What we have to protect are the healthcare workers and those who are at high risk, elderly, have chronic health conditions, or immunocompromised, who actually will have more serious impacts from COVID-19 infection, generally a really bad pneumonia that can lead into adult respiratory distress syndrome, which requires ventilation and can be deadly. So our goal here is not so much to be selfish about you when you are young and healthy, but is to be thoughtful of everybody else who's around you and not be a vector who transmits disease around to others.
Just following up, talking about social distancing, how do you get that message across to youths? Because we're seeing, I've noticed myself walking in our neighborhood, of course, keeping a good social distance, but I've noticed youths playing basketball. How serious? How do you get this message across to young people?
Well, the media right here is one of the ways that we absolutely can try to get the message across. We're trying to do a lot on social media. Parents have really got to talk to their kids. They've got to give them the same consistent message and figure out how to allow them to stay social and to get together with still maintaining some distance. And basketball is a contact sport, so that word contact there in sport, those are the ones we want to avoid right now. It's just got to be vigilance on the part of everyone.
There are several downstate communities, and again, downstate communities that have outlawed contact sports, such as basketball, because this is a prevalent sport that's played by the youth, again, to pass the time. But we have not done that yet. But we urge parents, as Mrs. Schuyler has said, we urge parents to remind their children that you must maintain the social distancing. This is something we need to be vigilant about. We need to practice this, and those types of precautions are what's going to help us and keep this mitigated as best we can.
Thank you.
Yep. Western New York News Now. Justin.
For those who maybe are just joining the broadcast, because I know we've gotten a few people tuning in so far, can you tell us again the ages of the folks who are just released to have COVID-19?
Certainly. Our two new positive cases are a gentleman in his 60s with recent travel to the New York City area, and a second is a female in her 30s with no recent travel history.
And then the decision to not explain specifically where they live within the county, I know you did with the previous cases. Can you again explain why at this point we're taking that decision?
Well, honestly, even though we have two city centers in Chautauqua County, we are a rural county. And the last thing that I want to see happen are people picking up pitchforks and going on a witch hunt. That it's not right and it's not fair. We are in a pandemic with community spread. That means it's everywhere. It's no one's fault, and no one should be treated that way. Now is the time to band together, do what we can do to stop the spread of disease, not point fingers and not try to blame, and not be busybodies to try to figure out how much information we can figure out. I promise you, if there's something you need to know, we will tell you. If you have been a close contact, you will receive a phone call from one of my nurses. And even without a close contact, be aware, this is a pandemic. That's what that means. We have a coronavirus, novel coronavirus, circulating here that can cause a severe COVID-19 infection.
The process where people are quarantined, I spoke to Cattaraugus County leaders yesterday who said that at this point there are sometimes the entire family is placed under a precautionary quarantine because one person is awaiting test results. What's the process here?
The process is basically the same. Public health law in New York State is the same for all counties. The difference when you're looking at mandatory versus precautionary quarantine, mandatory means someone has confirmed positive, and in that case, all of their household contacts would also be forced into a mandatory quarantine. Precautionary quarantine means we don't have definite sign like a positive case, where they could be someone who traveled to an area, so we're going to watch them very closely because they were in China at that time. Or it could be a proximal contact, so that would be somebody who doesn't live within the same household, but they still were in close contact, as we're talking, 6 feet is pretty much the range, for enough period of time that they could have been exposed.
So for folks who maybe do feel ill and they're not necessarily in a quarantine, but they have an appointment scheduled with their doctors, at this point, the recommendation is still stay home?
Absolutely. Please still stay home. If you don't feel good, if you start to have a fever, if you have any cough or the other signs and symptoms, we still are asking you to stay home. You can call your healthcare provider, discuss your symptoms with him or her. Please don't call 911 or go to the emergency room unless you have a life-threatening emergency. It's very important that we preserve our hospitals for those who really, really need them, and that we absolutely protect the health of our healthcare workers at this time.
I've talked to some of our viewers who were concerned because they do feel ill, but when they've talked to their primary care doctor, they say, well, I can't give you a test right now. What do you say to them? Because it seems like there's a little bit of frustration where people are like, I want to get tested, but at the same time, the tests aren't necessarily available.
Exactly. The question was, what do you say to people who are frustrated because they're feeling ill and they want to be tested? And they have talked to their healthcare provider who tells them, I understand, but there's no testing available. I'd say, I feel your frustration. I can completely appreciate your frustration. And I wish we were not in the situation that we're in right now in our country, but this is where we are. The test result is not going to make a large difference because there is no treatment, there's no vaccine, nothing is going to change unless you become more severely ill. That is when then things could escalate to where you do need hospitalization and a higher level of care. But for right now, the best thing you can do is stay home, isolate yourself away from your other family members, and do what you would do anytime, even what we've traditionally told you with the flu. Drink plenty of fluids, get plenty of rest, monitor your fever, and take Tylenol as needed for your fever.
I'd just like to add, as we sit here, this is personal. My daughter has been in the Czech Republic since August of last year. She was an exchange student. It's a level 3 area as declared by the CDC. She was brought home, and while she was there, she was in quarantine. The Czech Republic, you were not allowed to leave your house unless you had a mask. And at that time, she has been quarantined over there, and she's now living in a house in Charlotte, quarantined by herself, and for 14 days. And at that time, we'll pick her up and bring her home. But the quarantine, as precaution, is being taken by my family. We have a situation, and it doesn't get much more personal when you haven't seen your child in 7 to 8 months, and they're here, but they're still not home for 14 days because that's the precaution. So I'm following precautions the same as everybody else. So I urge everybody to remember that social distancing. And again, if you're traveling into this area, as Mrs. Schuyler had said, isolate yourself for the 14 days. Give yourself that time to make sure your symptoms don't flare up. And again, we're all doing this. This is not one person over another. We ask everybody in Chautauqua County to practice social distancing. If you're sick, stay home. And if you're coming back to the area, keep yourself isolated for 14 days, and we'll see where you are. But again, this is everywhere. We're facing this issue together, and it's affecting us all.
If I can ask one question, in regards to the economic, I'll keep that second, I guess, because in the topic of the actual virus, and the social distancing, if people don't follow the social distancing measures, do you think that county leaders will take steps to try to enforce those harder?
That's a very difficult challenge. We're asking people right now, and we have not seen that anywhere in New York State as far as issuing anything other than urging residents to follow our recommendations. That's a very challenging situation, and I speak nightly with leaders from across New York State, and that topic hasn't been brought up as far as how do we enforce it more or what type of enforcement is out there. We just urge everyone and continue to urge, and if you turn on the television and you have any concern that it's there, everyone's saying the same message. Stay home, stay safe, keep your social distance, and we'll get through this.
Because it seems like as of last weekend, and maybe it'll change, and we don't know what will happen, but a lot of churches were still getting together. People are at parks, and like you talked about with the kids, it's difficult because we're trying to detach from what we're used to doing. What kind of just day-to-day advice, I suppose, do you say to someone who's like, this is my life, this is what I do?
Well, this is an unprecedented time, and we're asking people to do unprecedented things. Socially distancing ourselves and being safe and protecting others, I think that's an inherent human nature trait. We need to take care of one another. We need to, love thy neighbor. Really, that's what we're doing is asking everybody to protect your neighbor. Social distancing is that, asking people to follow our recommendations. Again, it's really, we can do it as much as we can. I don't know how else we can put it. If people don't do that, that's their own prerogative. But you have to remember, it's not yourself, it's everybody else. Those are the people, and I said it before, we have to protect those who are most vulnerable. We have a generation of people who have risen to the occasion. And the same statement has been made here. We haven't mobilized industry to the likes we're asking now since the 1940s and World War II. And it's the same generation that stepped up and did all of those things at the same request 70-some years ago. Now, 70 years later, they're the ones who are vulnerable, and this new generation is asked to step up, and we're asking that new generation to help protect the original group that did it back in the 1940s. So again, think of that. Think of your grandmother, your great-grandmother, or great-grandfather, your grandparents. Those are the people we're asking you to protect, along with yourself, but it's everybody that you look up to, your elders, the people that have maybe the people that have raised you, the people that have cared for you. Now we need to take care of them.
And on that business point, we've seen a lot of revolutionary ideas where local businesses have said, I can help by making this. Let's bring our people back. Let's practice safe social distancing on the floor, and let's make this product. Since our conversation Wednesday, has there been any new developments on that front?
We have a couple of businesses locally that are developing products right now, and as we're able to roll them out, we will. There are people in Chautauqua County right now that have answered the call, as I put it, and are doing what they can to help produce, whether it's PPEs or using the existing supplies that they may have and getting those out to other communities. Again, this is a call to it's a call for help. The government has asked people to, they'll help those businesses and step up. That's the phrase we know in this generation. Step up and help. Whether it's your business or a small business, people are thinking outside the box in many occasions and in many situations to answer the call. Answer the call for help and helping our neighbors. And, right here, as we know, New York State is the new epicenter, and we need to help one another. And I'm sure there's businesses in Chautauqua County that could help a business in New York City or Long Island, just like if we were the epicenter and, places in Long Island, New York City would help Chautauqua County. So the efforts are being made. I know Mark Geis and our IDA has compiled a list of those businesses that are stepping up and doing things for production. So if you are a business, if you go to our IDA website, get in touch with Mark Geis and his staff. They're working around the clock pretty much to get that information out. But we have people right here in Chautauqua County that have answered the call and are doing a tremendous job to help the supply chain of personal protective equipment.
And on that point of New York State being the epicenter, it seems like nationwide, I had a conversation with someone earlier today, and either one of you could grab this question, but New York City, it seems like when you see the governor come on TV and talking about all the efforts that's happening there, a lot of people would say, well, that's New York City, that's not here. But like you've said from the beginning, the virus is here. We see the cases now that the testing resources are available. To the point of people who are concerned because they're like, we're not New York City. I own a farm. I can practice safe social distancing.
Well, the question is, what can we do? We are quite different from New York City. There's no two ways about it. We're a rural community, but at the same time, we're all New Yorkers, and we all need to protect one another. Social distancing is what we're asking, and we've been doing that for a while, and we have 5 cases. So continue our social distancing. We know it's here. We need to do the best we can so we're not one of those clusters. We're not the new epicenter. That's what we're urging. Is we ask everybody is, look, if we're not New York City, then we don't want to be the likes of New York City with a big cluster of infectious cases. So again, social distancing, although we're not there, we still need to keep that same safe practice as we move forward to protect our residents.
And how many tests are pending still?
The question is how many tests are pending? That would be 49
49.
that we know of. We still don't know if other ones that are out there that the health department was not notified of. Those are the ones that we have been made aware of and are awaiting results.
And why isn't the health department being notified of every single test that comes through?
Because not every healthcare provider is including us when they order a test.
Oh. So do you urge healthcare providers?
Absolutely, I urge healthcare providers to notify us when they are ordering a test. Absolutely. I urge like crazy. I'm urging people to do all kinds of things right now like crazy. And a big part of it is just common sense. Use some common sense. This isn't to be taken lightly. This isn't a little cold that's running around here. This is a worldwide pandemic. So please, use your common sense. Stay home when you're sick. There's not one of us around here whose job is so important that we really have to go into the office today. None of us. If you become sick, stay home. And please keep your distance between other people.
This time we'll wrap everything up. I'd like to remind everybody, stay home, stay safe, and we will be Chautauqua strong. Thank you.